If your poop has changed recently, more frequent, looser, harder, or even a different shape, it might be your body's quiet way of flagging something more serious. Don't ignore it. Hi, I'm Dr. Mikki from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Today, we're talking about a tough but vital topic, the early warning signs of colon cancer. Now, before you swipe away thinking this doesn't apply to you, hear this: colon cancer is one of the most common cancers worldwide, and it often develops quietly, without dramatic symptoms, until it's harder to treat. The good news? Catching it early can significantly improve your chances of successful treatment. Let me start by sharing something personal. One of our users, Maria, a 42-year-old teacher, came to our symptom checker complaining about changes in bowel habits and some occasional cramping. She figured it was just stress. But when her symptoms didn't improve after a few weeks, she saw a doctor. Long story short, early-stage colon cancer. Because she caught it early, her prognosis is excellent. Her story isn't unique. Colon cancer typically starts as small, non-cancerous polyps in the colon or rectum. Over time, some of these polyps can turn into cancer, often without you feeling a thing at first. But there are early symptoms your body may be using to speak to you. Here are 5 you should never ignore. 1. Changes in bowel habits. If you notice persistent diarrhea or constipation, or even a change in the shape or color of your stool, that's worth noting. Stool that's unusually narrow or stringy can suggest a blockage, which sometimes indicates a growth in the colon. Also, pay attention to new urges to go, even just after you've gone. 2. Blood in the stool. This one's a big red flag. Bright red blood might come from the rectum, while dark, tarry stool could mean bleeding higher up in the colon. Yes, hemorrhoids can cause similar symptoms, but it's always better to have it checked out. Blood is never normal in your stool. 3. Abdominal pain or discomfort. Ongoing cramping, gas, or a feeling of fullness can be signs. And it's not usually sharp pain, it's that dull, annoying ache you might shrug off. One user described it as just enough to notice, but not enough to cancel plans. That's exactly the kind of symptom your doctor wants to hear about. 4. Unexplained weight loss. Losing weight without trying may sound like a bonus until you realize your body could be fighting more than just calories. Cancerous cells can wreak havoc on your metabolism. If you're eating normally and still dropping pounds, it's time to talk to your doctor. 5. Fatigue and weakness. You're sleeping okay, eating fine, but still dragging through the day. This could be from internal blood loss or your body's reduced ability to absorb nutrients, both potential signs of colon cancer. Now, it's crucial to remember, these symptoms don't always mean cancer. Sometimes it's IBS, dietary changes, or something as mild as a stomach bug. But persistent, nagging symptoms are your body's way of saying, please investigate. If you're looking for ways to manage symptoms while you wait for care, here are some supportive home tips. For constipation, increase your fiber intake, fruits, veggies, whole grains, and stay hydrated. If diarrhea is the issue, stick to a brat diet, bananas, rice, applesauce, toast, temporarily, and avoid caffeine and high-fat foods. Exercise gently, even walking daily, to help regulate bowel movements. And track your symptoms. Writing down frequency, appearance of stool, and any associated pain can help guide your doctor or our AI symptom checker toward an accurate insight. Remember, regardless of your age, listening to your gut literally can make a big difference in your health. Worried about your own health? Start by checking in with a UB symptom checker at ubhealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. If you found this helpful, don't forget to like this video and follow for more doctor-approved info you can trust from UB Health. We're here to help you feel better, stay informed, and live healthier, one smart decision at a time.